Hello, everyone. We are happy to join and present during this year's Virtual Pharma Symposium. My name is Annie Thomas. I'm a faculty at Barcelona Hope School of Nursing at Loyola University, Chicago.
My name is Andrew Thomas. I'm a medical student applying for residency during this year's match. I'm a research assistant at University of Illinois' All of Us research program.
Our topic of today's presentation is utilizing telehealth model of practice to improve collaboration between primary care physician and specialist for digestive disease outcomes. Andrew and I initiated this review paper based on a case report in which a patient had to endure sufferings due to poor digestive disease outcomes. Acute and chronic digestive diseases are major public health problems and important causes of mortality and morbidity in the United States. Poor communication can lead to conflicting diagnosis, as you can see in this case report, and also poor digestive disease outcomes. Studies have demonstrated that interactive communication between primary care physician and digestive specialist can improve the outcomes and quality of life in patients. So there are various collaborative models that are proven to be effective, and in particular, the telehealth model that will improve the digestive disease outcomes and thus reducing patient burden. So the purpose of this presentation is to describe gap in interactive communication between primary care physician and specialists that led to poor digestive disease outcomes in a patient. And second purpose is to discuss how telehealth model of collaboration will open up opportunities to improve interactive communication between primary care physician and specialist, and thus improve the quality digestive disease outcomes.
I would now like to discuss a case report of a patient named Eliza, a 52-year-old female who presented with chronic digestive symptoms for 2 years. Her symptoms included bloating, flatulence, and abdominal pain. As seen on the poster, over the span of 2 years, she had visited many PCPs and specialists for symptom relief. Each visit to the physicians and specialist, workup done, referrals, and medical recommendations given to the patient are documented in this poster. In conclusion, after 2 years, there was no conclusive diagnosis made or no effective treatment plan recommended to alleviate the symptoms. So what is an effective solution to bridge this communication gap and improve patient outcomes in patients like Eliza? This brings us to Purpose 2, which proposes various collaborative models, particularly the telehealth model as an effective collaborative model of practice. Peer-reviewed articles from 2015 to 2020 were reviewed using multiple databases. The search yielded 7 studies on multiple collaborative models of care. 4 articles focused on using telehealth model as a collaborative tool. These 4 studies revealed the telehealth model that were employed by the primary care physician and specialist reduced the wait time for appointments, improved provider consultations, interdisciplinary consultation and collaboration, patient education, and follow-up phone calls. It also improved quality of care as evidenced by increased patient satisfaction, reduced cost for care, and patient progressing towards recovery. So this poster highlights the importance of an effective communication strategy between primary care physicians and specialists to help decrease patient burden due to chronic digestive diseases like Eliza's case. Telehealth model of practice can bridge this communication gap and decrease the patient burden of chronic digestive diseases. It will also lead to more efficient, higher quality, and cheaper care. In conclusion, based on this review, it is recommended to integrate telehealth model in clinical practice as it will allow the patient, as in this case report, and in general, to access the providers. It will assist the primary care providers to access the specialist and interprofessional healthcare providers. Thank you once again for attending our presentation. We would be happy to answer any questions that you may have related to this presentation. We appreciate your time. Thank you.